Stages of GERD. What is GERD? GERD, or Gastroesophageal Reflux Disease, is a more severe form of gastroesophageal reflux, where the stomach contents, including acid, flow back into the esophagus. This backflow can irritate and damage the esophagus, leading to various symptoms. Common symptoms include heartburn, a burning sensation in the chest, regurgitation, a sour or bitter taste in the throat, and chest pain. Other symptoms may include difficulty swallowing, a chronic cough, and a sore throat. What are stages of GERD? GERD, or Gastroesophageal Reflux Disease, is generally categorized into 4 stages. Mild GERD, Stage 1. Moderate GERD, Stage 2. Severe GERD, Stage 3. Reflux-induced precancerous lesions, or esophageal cancer. Stage 4. Let's discuss them in details. Stage 1. Mild GERD. Mild GERD, or Stage 1 GERD, is characterized by minimal esophageal inflammation, and it is typically easily managed with lifestyle changes and over-the-counter medications. This stage has 3 key features. Symptoms occur infrequently, such as once or twice a month, and are relatively mild. Mild heartburn and regurgitation are the primary symptoms. Lifestyle modifications, like diet and exercise changes, and over-the-counter acid-reducing medications are often sufficient for management. Stage 2. Moderate GERD. Moderate GERD is characterized by more frequent and bothersome symptoms of acid reflux, often requiring daily prescription medication for relief. Symptoms may impact daily activities and include frequent heartburn and regurgitation. Inflammation of the esophagus is also common at this stage. This stage has 3 key features. Symptoms become more frequent, potentially occurring several times a week, and it may start to interfere with daily activities. Esophageal inflammation may be present. Prescription-strength, acid-suppressing medications, like H2 blockers or proton pump inhibitors, are usually required. Stage 3. Severe GERD. Stage 3 GERD, or severe GERD, is characterized by frequent and intense symptoms that significantly impact a person's quality of life. Individuals in this stage experience noticeable discomfort, including persistent heartburn, regurgitation, and a chronic cough, often multiple times a week or even daily. Medications may not adequately control symptoms, and there's an increased risk of complications. This stage has 3 key features. Symptoms are persistent and difficult to control, even with prescription medications. Esophageal inflammation is likely, and quality of life may be significantly impacted. In some cases, surgical intervention might be considered to correct the issue. Stage 4. Reflux-induced precancerous lesions, or esophageal cancer. Stage for reflux-induced precancerous lesions or esophageal cancer signifies the most advanced stage of GERD, where long-term, uncontrolled reflux has led to precancerous changes or actual esophageal cancer. This stage often involves cancer that has spread to distant lymph nodes or other organs. Approximately 10% of GERD patients progress to this stage if reflux is not managed. This stage has 3 key features. This stage develops after prolonged, untreated severe GERD. It can lead to precancerous changes in the esophagus, such as Barrett's esophagus, or even esophageal cancer. Close monitoring and treatment are crucial at this stage to manage the condition and prevent further complications.